Dr. Angela Dunn, Executive Director of the Salt Lake County Health Department.
Yep.
Thank you for taking some time with the Tribune. Let's start out. We just finished with you giving a presentation to the Salt Lake County Council. Talk to me about what the priority is right now for you and the department as far as the message you're trying to get out about COVID and vaccines and all that.
Sure. So the number one message is, of course, get vaccinated if you're eligible. That is our number one tool to fight this disease. And we just don't have enough eligible adults who are vaccinated yet to provide that protection to our vulnerable or those children who can't get vaccinated. So the second main objective we have is opening schools in a safe way in a couple of weeks, especially for those kids under 12 who aren't eligible for the vaccine yet.
Okay. The issue of children and the vaccine. You've talked about how at this point children 11 and under are not eligible for the vaccine, and trying to do everything possible to help those kids until such time as there is a vaccine.
Yes.
How do you go about that?
So as we've seen throughout this pandemic, it's a layered approach. No one approach other than vaccine is going to work, and unfortunately we aren't at a time right now with enough vaccinations to be able to rely on vaccination alone to prevent COVID from infecting those who aren't vaccinated and who can't get vaccinated. So we have to rely on, one, increasing our vaccination rates among adults. 20 to 40-year-olds continues to be our lowest vaccination rate, and those are the parents of the kids under 12, and so they can be at risk, in the school setting and also at home. I think the second piece that we know is the most effective approach is mask wearing. And as political, unfortunately, as that has become, it is scientifically proven to be the next best barrier to getting COVID other than vaccine. So children who are unvaccinated or ineligible for vaccination, when they're indoors in a crowded setting with a bunch of other unvaccinated individuals, the best thing they can do is put on a mask to protect themselves and protect others from getting COVID. The other strategies that have been part of our normal life for the past 18 months include physical distancing and avoiding large crowded indoor settings. Those still are a mainstay in our prevention measures, and of course getting tested whenever you feel sick or a contact. That'll really help us continue to curb this pandemic. And I think we all expected to be in a different place in now August of 2021. But again, we just haven't seen that uptake that we hope for in the vaccine.
Right. The idea of masking, having children masked in schools is obviously a very emotional one for a lot of parents.
Yeah.
We witnessed that in the public comment period before this meeting, at the start of this meeting for about 2 hours worth. How do you juggle that? How do you balance the emotional side of it with the scientific?
My job is purely to provide the best scientific evidence recommendations to our county council and to our public. Just as when you go to your primary care physician or your own doc, they give you their best advice on how to keep you healthy. I view my job in the same way for the Salt Lake County population, that it's my job to give the best evidence-based advice to the Salt Lake County population to keep themselves and their families safe and healthy. And so that emotional piece is part of it, but I don't let that impact my recommendations. I think we all need to be sensitive to and respectful of different opinions and ways of thinking, but that definitely won't impact the advice I give. I think it helps me understand where the public is, and our goal in public health is always to meet people where they're at. So if people are really against having their kids in masks and they're not going to do it, what are the other options that they can do to keep their kids safe? So we try to kind of take it from that motivational interviewing type standpoint of trying to meet people where they're at and then bring them along.
Right. Okay. Because at the end of the public comment period, two members of the county council expressed the opinion that they would not vote for a mask mandate in schools, or for children right now.
Okay.
So that for now that would seem to be off the table as far as trying to, because according to the law now, you can create a mandate, but the county council could overturn it very quickly. And even if they did not overturn it, then the legislature, if they're in session, can also overturn that as well. Is that am I getting that right?
Yep. So
Okay.
the county council requires a majority vote, and that's what a wonderful way democracy works, right? We don't expect to build consensus or agreement, but we do lead by majority vote in some instances, and that's the way that the legislature has laid this out. And then, of course, the state legislature can come into special session if they're not in session and pass a joint resolution to overturn any mandate that a local health officer puts in place.
Okay, so short of you as the county health director, issuing an edict, issuing a mandate, what can you do to at least prod people along, or to suggest or recommend people that kids mask up when they're in school?
Sure. So, I mean, one, of course, is public messaging and public campaign of trying to normalize that mask wearing again. I mean, it's tough when you walk into a store and nobody's in a mask and you're the only one in there. It's just interesting psychology. You feel like you're making a statement, but you're not. You're just trying to protect yourself and your family. So really trying to normalize mask wearing in our communities again is part of our charge. The other piece is I'm working directly with all superintendents in all schools, private and charter, throughout our county on a weekly basis to try to help them understand how to keep the kids safe in their school setting, giving some of these limitations and mandates and requirements. So we're working together and doing such thing as offering testing for anybody who wants it, helping them figure out how to arrange their classrooms again to have that 3 foot or 6 foot distance, and what are those other layered approaches that they can take if not a mask mandate.
Okay. You talk about how your job with the county is to be, give the county council the best recommendation, the best scientific evidence.
Yes.
That's very similar to what you were doing as state epidemiologist.
Yes.
With the governor. What is the difference as far, because
Sure.
I mean, you're actually running a department as opposed
yeah.
to being a part of it. What's
I think
the main difference?
The key difference here is I actually have the authority to write the mask mandate. In this instance, though, because the county council can overturn it immediately, it is essential that I seek alignment with them before writing any mandate, because, like I said in the county council meeting, like, I don't want to see this play out in the media with full of drama with, oh, Dr. Dunn requires a mask mandate. The next day, the county council overturns it. The goal is for us to be in lockstep in terms of how we're going to approach this. And that's all I'm doing with my county council, is talking with them one-on-one and in a group in a public setting to address their concerns and hear each other. But it really is futile for me to issue anything that they would just overturn the next day.
Okay, let's go back a couple months to when you left the state health department to come take this job. What was the process for coming over to the county? They come talk to you, or I mean, what happened?
So I'll start by saying the Salt Lake County health officer job is something that I would have applied to, have COVID happened or not.
Right.
This is an awesome opportunity in my career to serve at a more local, on the ground level, be directly connected with the people I'm serving. It is something that I am seeking in my career beyond whatever my experience was at the state. COVID definitely expedited that a little bit. I think mostly because of kind of what we talked about before. As the state epidemiologist, I was purely in an advisory role.
Right.
And throughout, as the pandemic progressed and all the changes in the health department progressed, I saw my role becoming less and less effective. And it was time for me to move on.
Why do you feel it was getting less and less effective?
I think that's a really good question. So I think there were definitely different personalities at play. I think in the public, I became this poster child for, Fauci or the liberal left or whatever. People just pinned that on me, right? It wasn't my doing, that I think likely alienated some of state leadership and didn't allow me to be as effective as I wanted to in my job. And that's okay. I mean, I love the people that work at the state health department are incredible, but they deserve a state epidemiologist that can be effective at all levels of state leadership. And I just felt that my time there was up and I could be more effective, not only in Salt Lake County Health, but also state health by leading the Salt Lake County Health Department.
Okay. What this would have been maybe around the time as the pandemic Endgame bill was being, the pandemic Endgame bill,
Yep.
Special session of the legislature, that seemed to be the point where the legislature was done listening to the science, in a sense.
Sure. Okay.
Is that? I mean,
And maybe that was part of it too. So I wasn't involved in any of those conversations. I had
Right.
already kind of been pushed out by that point. So I don't think that had anything to do with me leaving specifically. But yeah, I think it's hard for any public health practitioner to see that bill and not feel undermined in some way.
Right.
It's a tough situation all around right now.
Right. Well, I mean, there was when you were in the state health department, there was it seemed to be quite a balancing act to how far you could push with your advice. What was the biggest challenge in where you could push and where you couldn't push?
I will say that when Governor Cox became governor, it became a much more open conversation, and I was part of that with him in the executive office there, the executive branch, and it really felt like a good partnership between health and the executive branch. I felt free to express my opinions. We had a very open dialogue about a lot of controversial things, and he's very open with his thought process and how things are going, and we all have different jobs, and I honestly would never want the elected official job, and I'm sure he would never want the health officer job, and so it was a great partnership. So that was fantastic. I think the hard part came in negotiating the politics with legislative leadership. I think that's tricky because it's not as open of a conversation. So it was hard for me to understand kind of where people were coming from, what they expected, and where they wanted to go. Yet the influence on the health department and how we responded to things was immense. And so it was a trickier situation with the legislative leadership, but executive branch was fantastic.
Right. What was your learning curve like in terms of having to navigate the political side of things?
Sharp and quick. I mean, it started spring of, was it 2020? Was it only 2020?
It's only been 2020.
Oh, God. So very quickly, before we even had our first case, first community spread, I should say, it became evident that we needed elected officials to be engaged with how we responded. And I think that's a huge lesson learned for public health. We just respond and we do what we know is right, but I don't think we engaged our elected officials early enough or quick enough. So they didn't have a good understanding of what we were doing or what we were capable of doing, and so kind of assumed we weren't doing anything or didn't know what we were doing. So, try to fill that void with more, I would say, aggressive leadership on their part. And so that's something I think we've taken away as public health, and that's nationally too, not just Utah, that, it is important to engage our elected officials really early on in any of these processes. But my learning curve was just as steep as the rest of public health. I am very clearly very transparent and open, and I have no ulterior motives. I'm really here for just the health and the science. So it's hard for me to interact with people who might keep their cards closer to them and have other motivations. I'm savvier now. At the beginning, I was not as savvy as to kind of all those backroom discussions and how those things played out behind the scenes. Right. But now I understand their impact.
Because June, end of June of 2020, you sent a memo out.
Oh, Memogate.
Memogate.
That's what I fondly call it. Yep.
Where
that was a frustrating time.
We were at 200 cases a day roundabout, and you were saying that if we got up to 500, then things would have to change rapidly. That was the basis of your memo.
Yeah.
And 2 days after you sent it out, it wound up in the Tribune. I'm not sure how that happened.
Me neither.
It wasn't me. Different reporter. But then, as they say, all hell broke loose. What was the lesson for you there as far as?
So here's the thing, right? If I were to go back in time, I wouldn't have done anything different. So here's what I was feeling in that moment, and I remember it so well. At that June of 2020, I was out of every conversation, was banned from attending meetings. I mean, I could not have influence, but I'm watching the data and I'm seeing people get infected, knowing what's coming, seeing what was happening. Remember, Italy was all like the rage then, right? There were tons of deaths. We're going to become Italy. We need to figure this out. And then seeing how we were not responding in an effective way. And my only voice was an email. I didn't have a voice at a table to have that constructive conversation one-on-one or in a group with those who were leading the response to say, hey, here's my input. There was no health expert or medical expert at the table helping to guide that. So I felt like it was my duty to make sure that that health and medical advice was heard by those who were making the decisions for the sake of the public.
Right.
And so that was the background to writing that memo, to say, okay, if you're not going to listen to me, I'm going to put it in writing and here you go. It was not my intent at all for it to get leaked, because drama doesn't help anyone. It doesn't help the public health cause. It doesn't help people engage public health more. But alas, it got leaked. But that's why it was my only ability. And I will say though, after that, there was, media was part of this, kind of almost like an outcry. Why isn't there health at the table? And shortly thereafter, I was at all of the governor's leadership meetings in response. So whether or not that was, was I an effective voice? I don't know, but at least, I was a seat at the table. But ideally, you wouldn't have to get to that point, right? You would be part of those conversations to start with.
Well, after it all happened, Major General Burton had to issue, who was then running the health department, had to issue a statement saying, no, there's no truth to the rumor that
that was getting fired.
You're getting fired. Now, usually, if somebody puts out a statement like that, somebody somewhere has had the conversation. That
Absolutely,
you should be
I
fired.
was getting calls from I was on vacation in Moab and was getting calls from some legislators saying that I was going to get fired. So
I mean, what was that? What was that like from your end, from where you were?
I mean, I'm in a very fortunate position where I have experience and expertise, and I took this job, and I took a job in public health in order to make sure the public has all the information they need to keep themselves healthy. And when I see that that's not being done, I will continue to be that voice. And so if the trade-off is getting fired by doing something right, okay, I just, to me, that's a non-starter. Like I'm not someone who will just give in to threats, because I'm just here to help people save themselves and their families. I mean, I don't know. So it was frustrating, but it wasn't, when I got those calls, I was kind of like, okay, saw this coming, I mean, at some point, when I obviously knew I was not a favorite of some elected officials. You just have to take that risk.
Right. Okay. Pair of questions here. In the last 18 months, what was your worst day regarding COVID-19?
So I don't remember the specific day, but it was when initially our hospitals were completely overwhelmed and not able to provide care. And I have friends that work in ICUs and in the hospitals, and those are my colleagues, people that went to medical school with, that I trained with. And in addition to protecting the public, I view my job as helping my clinician friends and colleagues who are caring for patients one-on-one be able to provide that best care. And because COVID cases had overwhelmed our healthcare systems, I took that on myself. I had somehow failed. And I get it. I get that, yes, there's a bunch of different forces at play there. It wasn't me alone, but somehow I was not effective in my ability to control the pandemic, whether from a policy level, from an elected official level, or from a science level. And that resulted in my physician colleagues not being able to do their job, and that's heart-wrenching. That was a day I definitely broke down.
Okay. What, in the last 18 months, what's been your best day with watching the pandemic?
God, is there a best day? Definitely, I can tell you this. God, the day I felt elated is the day I did my first PSA for the vaccine. Mm-hmm. The vaccine wasn't even out yet, but we were filming it in anticipation. And it was like this light of, we are here, we have an effective vaccine, and we can promote it to people. Like that was awesome. That was an awesome feeling.
That's cool. What is going to be the indicator for you that we are well and truly done with all this?
definitely once a vaccine is available to all. I mean, we are so close, and I know I keep saying that, but I would even say 5 to 12. Like, it is important for 6 months to 4 years old to get vaccinated, but they're not causing a lot of problems, right? But that once we get our school-age kids vaccinated, we can legitimately treat with like other vaccine preventable diseases. Until that moment, we're not going to be there. I think kind of the caveat there is the booster, right?
Right.
And hopefully we don't have enough spread that's causing more mutations that escape our vaccines. But I have confidence that 2022 is going to be a good year.